Good morning, everyone. I'm Heather Gallegos, Chairwoman of the Saginaw County Chamber of Commerce Board of Directors. Welcome back to Perc Breakfast, the Zoom version. Before we get started, I would like to share some logistics for today's program. We recommend you view this event in speaker mode. That will give you the best flow with the least distraction. During the program, we will mute everyone except the designated speaker. But don't worry, we've got your networking covered with a virtual business card exchanged about halfway through the program. We will have a video later in the program, so you may need to adjust the volume on your device to a comfortable level. And now, let's begin our program, as we always do, with the Pledge of Allegiance. Please join me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. You should have received our Perc brochure as an attachment to your login email. In it, you'll find information on today's new members. There were some PDF attachments with information from today's sponsors. We encourage you to review these materials and support your fellow Chamber members with business whenever possible. The Chamber offers a variety of tools to help you expand your business connections and your bottom line. The Perc brochure is one of those tools. A variety of Chamber benefits is another. The Chamber benefit partners provide value-added benefit programs specifically for members of the Saginaw County Chamber of Commerce. The Chamber endorses their products and services, and the partners help support the Chamber's quality of life, community initiative, and member service programs. Because you belong, these value-added benefits can save you time and money. Each month, we will highlight one of these member benefits to make sure you have the information you need to take full advantage of your membership. This month's highlighted member benefit is AFLAC. AFLAC offers payroll insurance policies that provide cash income when a policyholder is sick, hurt, or unable to work. In fact, AFLAC is the #1 provider of voluntary insurance at the worksite in the United States. Learn more about AFLAC and other member benefits on the Chamber's website at www.saginawchamber.org. And now, please join me in welcoming your 2020 Chamber Ambassador Chair, Dawn Boucher from Manor Group. Hey, Dawn.
Okay, just had to unmute myself here a second. Good morning, everyone, and a special welcome to our newest Chamber members today. We are so happy you could join us. One of the best parts of belonging to the Saginaw County Chamber of Commerce is the opportunity to lift each other up and jointly support our community through business. Membership gives us access to a local support network for information, best practices for common challenges, new business leads, communication channels, and connection opportunities. That's why we're so happy that today's newest Chamber member decided to join us. And right now, I'd like to introduce them to you. Today's newest member is New York Life Insurance, Mark Laundra Agency. For more than 175 years, people have worked with New York Life to protect their families and futures. New York Life believes in the importance of human guidance and in trusted relationships built on being there when customers and community need them most. Welcome to the Chamber. And that's it for me this morning. Heather, it's back to you.
Thanks, Dawn. Well, I think I'm... Okay, thanks, Dawn. So we are going to mix things up a little bit this morning and feature our keynote presenters at the beginning of today's program. So now I'd like to welcome today's speaker sponsor with a brief message and then an introduction to today's featured speakers. From Dale Carnegie, please welcome Regional President and CEO and all-around great guy, Dan Hanley.
Well, thank you. We got a little, all right. There we go. Thank you, Heather.
You're welcome.
We're delighted to have the opportunity to be with you this morning and be the speaker sponsor. You know, one of the reasons I'm so delighted to be here this morning is we've actually been chamber members, Dale Carnegie has, for over 50 years. And that relationship just has created value for us as an organization. And we just want to thank all our clients in our community for our opportunity to serve you all these years as we've worked together to help you really strengthen your team's ability to execute and get things done. So chamber membership really pays off, and I'm just so delighted to support Saginaw and the Great Lakes Bay region. We as a team are. So let's get started. Just to give you an idea, you know, we really believe that transformation starts right here. It happens here in Saginaw, and it spreads throughout the world. And we look at it this way, that, you know, since March, this kind of certainly has come into play. One of my favorite poems is from Robert Frost, and he said, "Two roads diverged in a wood, and I took the one less traveled by, and that has made all the difference." By a show of hands, how many of you had to take the road less traveled in this past 6 months or so, right? We all have. And I'm very proud of our community and our ability to step up and move forward, and as we say, take command. So our commitment is really, how do we move from survive to thrive and really tip that balance as we're dealing with COVID-19? And certainly that's why today's speakers are going to really in alignment with that. So our focus as an organization, as we look at what do you want Dale Carnegie as an organization to do for you as we serve you in these communities? Do you want us to help you build your business, build your team, or even build me? And so our spirit of taking command comes back to what can we do at an individual level to transform our organization? What can we do at a team level or across our organization to be able, these are really the 5 areas that we support organizations in Saginaw, Great Lakes Bay region, and 90 countries. You know, how do we help grow revenue? How do we help get engagement moving and really enhance client and customer satisfaction, bring them back? And these are the ways you see we do it. The supporting structures to make these things happen are at the bottom of the screen. These are what we've been working to deliver for over 100 years. So meetings like this are taking place in Dale Carnegie in over 90 countries this morning in over 35 languages. The common commitment, though, is everyone wants to do these things, right? How do we tap into our potential? And ultimately, we talk about growing these things. You know, Peter Drucker famously said, "Culture eats strategy for breakfast," right? So as we're working with you to, whether you're a small organization or a large, we can really help you develop the culture you want. And study after study, including our own, just show that the key factor in driving a company's results clearly is its people and how engaged they are. So today, since this is a different time and people are working remotely around the world, Dale Carnegie, we've had a live online division for over 10 years. So we offer actually over 70 live online programs that are all instructor-led. These are not recordings or something. These are real-time instructor-led coaching opportunities to help you grow in 70 different areas. And these are just some of the clients that we work with and have worked with in a live online way to help them grow all around the world. We are actually the only global training company that's ISO certified. So what that means is that really believe in quality and delivering on our promise for you. And we've been consistently rated one of the top 20 human development companies in the world across leadership and sales training. And You know, that whole commitment, though, comes back to we got to help people grow. We need to consistently help people grow. This is something that you should have received yesterday from Lisa, and I know you did, which was really a flyer. What's happening in this region for people to take advantage of? I don't expect you to be able to read that. It really goes down to development opportunities that are happening locally that are all live online for you to be able to really tap into that skill that you want to grow, whether it's in your leadership skills or your presentation skills working online, whether it's building business and relationship selling and building trust. So our live online training really goes back to that individual focus. We coach that performer, that individual right in the moment. You're working with world-class trainers with a very flexible catalog that we assign and build around your needs. And social learning, this is not a one-way communication. You're involved. You're communicating. You're on chats. You're constantly working as you're being involved throughout this program. So our real commitment is, in some cases, people, what they really want to do is transform their working style. We'll help you build the courage, confidence, and compassion to take command of your role and inspire teamwork across your organization and help you transform your relationships even. You know, technical skills may get us in the door, but they're only half of the game. True excellence comes when we take our education, our experience, and we couple it with the mastery of our communication and our relationships. That's where that excellence comes. So we'll help you have clearer, more compelling interactions with people. You'll see a more innovative and supportive culture work across your organization. And it works. With graduates like Warren Buffett and 9 million others who have said it's made a tremendous impact on helping them take command, we can work with you to do the same, whether that's for you as an individual, as a team, as an organization. You know, it's a journey. We're an action-based company. We focus on learning by doing. We believe that's how adults learn best, and applying really time-tested principles that will help you strengthen your relationships, lead, and get things done together. So it really starts out with an emotional awareness, you know, emotional change. Where do I want to grow? And then really behavioral change. What are the experiences that will help me develop to be the kind of person I want to be or the organization I want to be? And ultimately, the performance change that we want. So it's a journey, that path to growth. As we say, you know, that emotional change, behavioral change is the only way we're going to get performance change. And as we talk about that, growth and comfort just cannot coexist. We've got to push ourselves, don't we? Evolving really does take guts. And we've seen people everywhere today as we're working with organizations in this community and live online training, just pushing themselves to keep growing in spite of what's happening. So it can really help us transform our business results, really from survival to thriving. So again, what do you want Dale Carnegie to do for you? Do you want us to help build your business, your team, or yourself? We're here to work with you to take command. Leverage the opportunities in this region and around the world to help you continue to grow, whether that's in face-to-face training or live online training to help you meet the kind of objectives that are important to you. So as we wrap this up, are you ready to begin on that journey? We're here to support you when you are. Please reach out to us. You'll see the information that was emailed to you yesterday. Take it, respond to us. We're here to support you. We'll listen. And so I now have the opportunity and privilege to introduce our speakers. And that's a real opportunity because certainly the topic is the right one for us today. We have the privilege of introducing a group of dedicated medical professionals who are here to tell us about some of the unique and creative collaborative efforts forged to address COVID-19 in this community, in our community. First of which is Christina Harrington. She was approved as a permanent public health officer for the Saginaw County Saginaw County Department of Health in November of 2017 by the Saginaw County Board of Commissioners. She had previously served the department in a variety of roles for actually 17 years prior to that. So as Chief Administrative Officer for the department, Christina works to protect and promote the health of individuals, families, and the Saginaw community while enforcing the Michigan Public Health Code and assuring public health services in Saginaw. She also represents the county on all matters of public health concerns. So we're delighted to have you here, Christina. Our second speaker I have the privilege of introducing is Dr. Delicia Pruitt. And she's the medical director for the Saginaw County Health Department, where she meets medical guidance she sets medical guidance for the county. She's also a full-time family physician with CMU Medical Education Partners, the director of Family Medical Education Program, and an associate professor of family medicine. She earned her medical degree from Wayne State University School of Medicine. And previously, Dr. Pruitt served as co-owner and president of Seals Medical Care. She was also chief of family practice at Covenant Hospital and was the medical director of American Hospice. She's a Saginaw native, and Dr. Pruitt has received significant recognition and awards for her service and support of the Saginaw community. We're delighted to have you here. In addition, we have Dr. Clark Headrick, who is the Chief Medical Officer and Interim Vice President of Medical Affairs for Ascension North Campus, which includes St. Mary's, Standish, and St. Joe's Tawas. He's also Regional Chief Medical Information Officer for Ascension Mid-Michigan. And finally, our fourth presenter today you'll hear from is Dr. Gayatri Shanker, who is a fellow of the American Academy of Pediatrics and has been board certified in pediatrics since 1995. She is co-owner of Partners in Pediatrics, as well as president of the Covenant Physician Organization. Dr. Shanker completed her degree at Seth Medical School in Mumbai, India, and her pediatric residency at the University of Texas Health Center in Houston. She also has a master's degree in biomedical science and engineering. So with all that, we have a very powerful group, as you see, who are ready to inform us on this very important subject. It's the right subject. We have the right people. Please help me welcome Christina Harrington to kick us off.
Good morning, everyone, and thank you so much, Dan, for the warm welcome and introductions to everyone here. I am one of the panelists that will be speaking with you today. I'm going to share my screen and go over a presentation that both Dr. Pruitt and I had put together. And then at the end, we'll give opportunity for Dr. Headrick and Dr. Shanker to give their perspectives on this collaborative effort that really has been, as we keep saying, a very unprecedented time. And so that's kind of how we'll run the presentation today. Let me share my screen here. So we're here to talk about COVID-19 in Saginaw. But first, let me just say a little bit about the health department and what is the role of a local health department. And as Dan had mentioned, we're here to uphold the Michigan Public Health Code. And in that code really gives three pretty broad representations of what a local health department does and prevent disease, prolong life, and promote health. And those are pretty broad terms. And what we do is sort of upfront what people know about and think about in terms of the health department. And prior to COVID, I probably would have asked many of you what you know about the health department. You might have said, well, I know you guys give shots, or I know that you have WIC services, or it's a place where people can go and get free formula for their babies. And the local health department really is so much more than that. I mean, we have over 50 services that we provide, and some of them are very much behind the scenes. Things like communicable disease investigations. So we do these on a daily and routine basis to prevent the disease spread across our community. And those are the things that people don't normally think about when they think about the health department, but these are things that we do day in and day out. So now when you look through the lens of COVID, people can say, okay, now I know a little bit more of what you're doing with contact tracing or case investigations. And so that's kind of put some of the forefront on some of the behind the scenes services that we do provide in our community. But really, we're a part of a public health system. And in Saginaw, we can take each of these eggs, as you can see here, and equate that to businesses and organizations. So we're all a part of this system. So yes, the health department should be the nucleus of our system, but this is meant purposely to look a little messy, a little convoluted, a little complex, because our public health system is very complex. Many of you on this call are a part of this system because of the programs and services that you provide. Even if you're a business and you're doing worksite wellness type programs, you're a part of our public health system. If we can prevent disease, prolong life, and promote health, we're all a part of this. So we know as a health department that we can't do this all alone, and nor would we want to do this all alone. So collaboration is what we do. We're not really typically a direct service provider. We're not a primary care office. We're here to refer. We're here to coordinate, to collaborate. Those are the essential functions really of how a health department operates. And so we need all of us. We need all of our partners together in order to make any sort of response to a pandemic or an epidemic or alike. So when we work to improve, health outcomes, we need that system in place. So I thought we would go back just a little bit and look at a timeline of events, just to kind of put our context around sort of what public health has really been doing this time. And it really has been 6 months. As Dr. Pruitt and I were planning for this presentation, looking back and thinking 6 months has been an unprecedented time for public health. For all of us, obviously, but particularly among what we've been doing. We really are dating back and thinking about in February, we started planning, we started talking about, okay, we're seeing this COVID-19 and it's in the Eastern Hemisphere, and when will the first cases come to the United States? And we knew it was coming. And so planning was really strong, really early on. And we have emergency preparedness programs, of which that I actually had the opportunity to serve in for about 15 years. And so emergency management, emergency preparedness are things that we're well versed in public health. And so we started looking at all those plans, and we held a really large scale healthcare provider meeting. And you'll notice that was on March 11th, right before stay-at-home orders and sort of the restrictions got put into place. And so it was a really great time. We had all of our health system partners in one room here at the health department to talk about, okay, these cases are coming, COVID-19 is here, and what are we going to do? It wasn't quite here yet in Saginaw County, but we knew that it was coming. And so we were actually one of the first health departments, actually the first health department in the state to send COVID samples to the Michigan Bureau of Labs. And if you recall, at the end of February, that was the one lab that did COVID-19 testing in all of the state of Michigan. And so ramping up testing was something that we were definitely focused on, and you're going to hear a little bit more about that when Dr. Pruitt talks about how we've coordinated testing here locally and utilizing our medical command and control group. So kind of through the scurry of March, we had a lot of activations of our incident command system. On March 21st was our first confirmed case of a Saginaw County resident. And so that really put us really into hyperdrive. And so in that really 2 to 3 week period in the month of March, we were dealing with the first cases, coordination of testing, trying to get healthcare providers on the same page. We had a hotline established because we were getting phone calls were ringing. Every extension in the health department was ringing off the hook. We talked about getting and expanding testing for sampling sites, utilizing our partnerships and collaboration, and really said, you know what, we need to get out in front of the communications and make sure people are hearing credible, right information, and started to report out numbers already, I think by about March 23rd, 24th timeframe of when we started to see those first cases come in and how many tests were pending, and the alike. So it was definitely an incredibly busy time for us, particularly in the month of April, when we used 95% of our staff really have been dedicated to the COVID-19 response. The sort of amazing part of this is that that large number of staff being reassigned is still 6 months later, still tried and true. It's been something that none of us could have anticipated, I think at that time, knowing that it would be this long with this kind of a dedicated effort in terms of public health. And so when I say 95% of our staffing, it's really all hands on deck. And it's from the investigations and contact tracing that you probably know that the health department does. When a COVID-19 positive case comes in, it's our nurses and our staff that are calling each positive case and figuring out who their direct close contacts are, where they've been, where exposures may have happened. But it's really then doing daily monitoring of those contacts. And in April, we were tracking all of those folks. And there was still a lot of movement in that March timeframe where we saw lots of people were having a lot of contacts per case, too many contacts per case, actually. And we had just unprecedented numbers coming in, 40 to 50 new cases daily, really as our peak in mid-April. So staff are really dealing with that. Phones continue to ring off the hook from providers to the public. And everyone alike, organizations and businesses, we're really calling and asking lots of questions. And we really, Dan, as you mentioned, taking the road less traveled, this is an interesting, I think, correlation here is that we felt like we were paving a road while we were trying to run down it. And it's really been something that taking all of this, as we know, as a novel virus, this is something we've not seen before. And so I'm sure all of us realize the unknowns that are associated with COVID-19. If you get an antibody test, does it tell you if you've got COVID? How long should you stay home? Do you continue to test positive after your 10 days of isolation? There's so many things around this virus that we still yet don't know. And so all of the engagements and the speaking and the updates that we've provided to many organizations and businesses alike, usually start out always by saying what I say today, what I say at the beginning of this presentation might change by the time the presentation is over, because it's evolving that rapidly. So we really felt like, we knew we were definitely going down a road less traveled, but felt like we were just having to run down this road and figure things out. And as much as I'm sure all of you sort of have felt the strains and the stressors as it relates to that. So we were really working collaboratively to say what we can do as a community to ensure testing, to ensure access to care, and to ensure that our health system partners had appropriate personal protective equipment, which we all know has been incredibly short supply and frankly still is as we work through this. And so these are some of the things that we really tried to tackle early on, which really is, how do you allocate scarce medical resources in a time of an emergency? And those are really hard questions, to answer. And so you'll hear from our system partners and Dr. Pruitt later about how we sort of worked through that collectively as a community. And it's something that I'm really, really grateful for, the strong partnerships that we've had in this community and continue to have in this community to work through this effort. So looking back then in May was really good. We didn't realize it was really good, but May was really good because our trending was downward, but deaths were a problem and deaths were rising. Cases, we were sort of past that peak. And so as our communications, we said, okay, community, we're past our peak. We're coming down in the number of daily new cases, but we had way too many deaths in congregate care settings. Majority of our deaths were in long-term care, unfortunately, and our poor long-term cares were under-resourced and didn't have, PPE and mechanisms in place, and they were doing absolute best they could. And so we were working really closely with them to try to get testing, to try to get resources, to help them through this really difficult time. Obviously, we know that the executive orders have been in abundance and continue to be in abundance. We're almost to 200, I think. It's 170 some last time I looked, and it seems like some get added every day. And so we get a lot of calls on interpretations of those. And so those calls still keep coming in, and that really never has changed. But one good thing, and I think that's what we saw in May, was that the number of contacts per case were really down, but that's when we were under stay-at-home orders. So people weren't out and about having direct contact at their places of business. this. It was mostly just within households, right? And so when you had 1 or 2 direct contacts per case, we're going to see less community spread because we're breaking the transmission cycle. So, that part was really good. And then came the flood. So we had another unprecedented moment in Saginaw and Midland counties and some of the surrounding areas where we then had a pandemic on our hands and evacuations and catastrophic flooding. So Emergency Operations Center was activated, I believe on a Tuesday night when the thought of the dams had broken, and the collective effort amongst all of the Emergency Operations Center functions really pulled together quickly in sort of a virtual environment, which we had never really done before. The idea is a disaster strikes, everyone gets in one room, and we can work a problem with all of those seats in an emergency operations center. And we didn't have the liberty of doing that. And our fire chiefs were out and they were evacuating areas, some of which were assisted living and long-term care. And so guidance and resources about how do we control the spread of disease in a time when another emergency is layered on top of that created an intense amount of complexities, working with long-term cares that had no COVID in their facility that now have to send their patients out into other environments where there may or may not be COVID. And the scary part that we were thinking about, the last thing we want is them to bring COVID back when they come back to their facility. So working through those strategies collectively as a community, in addition with some of our partners at Michigan Department of Health and Human Services, was really, really crucial as we moved forward in doing that. June testing was limited, but we started to see expansion of testing happening and PPE started sort of trickling in a little bit. We got some resources from the state and through the emergency management. We got a lot of great support from business community across this region to supply and make and distribute personal protective equipment in a way that was completely unprecedented. And so that effort collectively is something that I think we should all be very proud of as we tried to augment and create masks and gowns and face shields from businesses like Duralast and Nextier, ones that obviously don't do that on a daily basis. And so that was really helpful to our healthcare community and made great progress and strides. And so obviously June was great. We saw our lowest number of daily new cases. We started to see deaths started to slow down a little bit. And that, thankfully has continued to happen throughout this. So I'm really excited about that. But it didn't slow down for public health at all, because the next thing we knew was, okay, we were moving into phase 4 of the My Start Safe plan, which was great. And then, school guidance came out. And so that really put schools into hyperdrive. And so we've spent so much of July and August thinking about how do we prepare schools to begin. So planning, we've held parent forums, we've talked to the superintendents and school administrators and dealing with that. And then we saw an uptick in cases. And, that 4th of July holiday happened. And 2 weeks after that, we saw this rise and we thought, okay, people are beginning to move out and about more. There's a lot more travel going on. Businesses are reopening and people are getting back to work. So we kind of expected a little bit of an uptick, but it really stayed this steady high. And that's what has been problematic and really stressed our local resources here. Contacts per case were almost 4.5. So for every positive, we had, almost 5 contacts, direct close contacts. And so the number of people that we're doing daily monitoring for just grew exponentially, which then, predicates the ability for that disease spread to happen more. And so this all has been kind of some of our most stressful time, as we now are seeing, mask mandates, executive orders coming out in different ways, but yet bars are still closed, but some businesses are allowed to open. So this has really been some of the most complex time for local health departments, and particularly ours, is that the calls keep coming and the cases keep coming, and testing is up, but yet now we're trying to reopen and move forward in a time where cases, continue to remain high. And so our resources have been just so incredibly stretched, and it's been unfortunate in that. So So the good news is that we've made some progress. As you know, if you look at the MyStart map, which is something that the state typically drives a lot of our information in terms of looking at positivity rates and cases per million and where risk levels are. And so you know that these risk levels kind of tie into the phases and what's being allowed or restricted when it comes out of the governor's office. And the Saginaw region and the Detroit region have moved to a high-risk status. And it's really because of, honestly, that August timeframe, we continue to see those cases that just, yeah, up and downs, but were higher than what we like to see. It was really no clear peak, and we remained sort of this high steady. And so cases per million have continued to be up. Over 40 cases per million is really the target here that's been created around. Same thing with positivity rates to be 4% or less. And so those are sort of the strides that we're continuously looking at on a daily basis, but that's kind of where we're at. And so in Saginaw, you can see here from our case counts, sort of as I go back at this timeline to look at where our cases have been, you can see that June timeframe is really when they were the lowest. And then that mid-July timeframe is where we've seen this sort of steady high. And there's been dips and spikes, but that's really what's put us into this high risk category. Good thing is our positivity rate that was up almost nearly 6% is back down to about 4. And our new cases per million, even last week, we're looking at about 83.6 or so cases per million, and we were really close to Macomb County, who's had an additional spike in cases. And so those type of numbers is sort of what has put us at a heightened state of awareness around looking at our case counts and seeing what's really going on in Saginaw. That's what we continue to get, is why are we seeing these in relation to other counties surrounding ours? What's making these case counts go up? And you know, one thing that we're thinking about as we see that is there really isn't any large major outbreaks. We've heard of the Central Michigan students coming back and they've got 100+ cases at CMU and other places where we hear, oh, there's a bunch of cases. We, you know, collectively looking at ours, our case counts are really not attributed to long-term care outbreaks anymore, which is a great thing because that's where we know that we've seen way too many deaths. And so, you know, from that perspective, things are very much, you know, under control when it comes to some of those congregate settings, which is a great stride for us. But we're seeing just a few cases here and there. Yes, there's cases in businesses, and we know that anytime we're out and about and we're leaving our homes, we know that there's an additional risk. And so we're going to see cases at businesses. We're going to see cases in the schools. We've been pretty clear about knowing that that's going to happen. And so we need to learn to manage those, to quickly identify them so that we can quickly mitigate them. So as we look back, we're really thinking about moving forward and how do we get back to providing some level of services. Now you're hearing about the flu and how important the flu vaccine is going to be as we move forward. And with really tight resources at the health department, it's going to be really difficult. But we need to be there to support our schools. And so school tracking is something I think that they've even announced across the state of Michigan we're going to be looking at, but here in Saginaw, we've got direct communications with the superintendents now to really talk about what is the data telling us, tracking cases in schools so that we can quickly mitigate those. You know, PPE is still an issue, so we're still having to struggle through that when we talk about provider offices. Even for us at the health department, you know, we've tried to distribute lots of PPE, but particularly N95 masks are really where the shortage still exists. And sometimes we're hearing that from some of our partners as well. And, you know, all of these things kind of coupled on top of each other where everyone's saying, okay, are we going to see this huge spike again in cases? And, you know, we're hopeful that with these strategies, we've learned some things along the way. We've got more tools in the toolbox as we continue to learn about the disease. So that's really beneficial. And knowing that we really have solid foundations in our collaborations and our partnerships developed has really helped us with leaps and bounds. And so I have a positive outlook when it comes to that. I think that we're making some good strides in our community. Are we going to see more cases? Yes, we are. Are we going to deal with them in the best way that we can? Absolutely. We're going to work closely with all those partners and the businesses that experience those cases and do quick contact tracing and really help mitigate any further additional spread. And so we're going to do all of these things, and with really, you know, budget constraints and not a lot of resources at the local health department level. And, you know, all of that then presents all these opportunities moving forward, but those opportunities are on a stressed system. So in the midst of all of this, you know, we have to do our budgets as a part of the county government situation for FY21, and we're seeing, you know, not enough money for not enough resources for not enough staffing. And, you know, much of what we fund builds capacity, and I think of what we've learned as a nation and as a state, and hopefully as Saginaw, is that resources are needed for things like this. And it doesn't just mean COVID. This isn't just for COVID. When we talk about rebuilding an infrastructure that's really necessary, it's making sure that we have the partnerships, the collaborations, and the resources necessary to scale up, to do large scale outbreaks, to do pandemics, so that we can do this on a daily basis moving forward and provide those really critical services like flu vaccines, or more importantly, when a COVID-19 vaccine does come out, which we're hearing different timeframes for that, maybe January, February timeframe. Is kind of what we've heard lastly from our immunization partners at the state health department. And when that comes out, there will be obviously resources distributed to Saginaw to provide mass vaccinations for our community. And that's really going to help further mitigate spread. And when that's there, the local health department is the one that's going to help order that vaccine, give it to partners to help distribute vaccine, and we will definitely be a resource to provide that to our community. And we need to have the proper resources to be able to do that. So for the first time ever, we're going to have a public health millage on the proposal of November's ballot, and hopefully we can move forward with resources, and just knowing that we are here as a local health department to provide a resource for all of our business community and all of our public health system partners. And that's what we're here to do, and that's what we'll continue to do moving forward. So with that, I'm going to turn it over to Dr. Pruitt, who then is going to talk about how we really establish these partnerships in Saginaw and what this medical command and control that I've sort of mentioned a few times is really all about. So Dr. Pruitt.
Hello, everyone. It's nice to be here with you. As Chris said, we had a lot of collaborations, so like with schools, businesses, nursing homes, but the one we really want to highlight today is our collaborations with our healthcare systems. This was a wonderful come together of all of our healthcare systems to provide guidance to Saginaw County. So I'll go to the next slide. So what is the Medical Command and Control? It's a group of medical providers from diverse fields of medicine that provide medical guidance. This guidance is developed from the input and expertise of each one of these physicians. The goal of the group was to provide consensus on medical care during a major incident like the pandemic. This guidance is communicated to healthcare providers and to the public. We were blessed to have people from all the different healthcare systems here. We had Dr. Clark Headrick, who is here today to speak with us. Dr. Sam Shaheen from CMU, Dr. Headrick is from Ascension St. Mary's, Covenant, Dr. Iris Martasia from Great Lakes Bay, Dr. Bender Coughlin, Health Source, Christine Rohr, and then independent physician who is also a pediatrician, Dr. Shanker, and then Dr. Hines, who's an OBGYN and family medicine doctor. We have multiple fields of medicine covered, surgery, OBGYN, pediatrics, family medicine, internal medicine. We had Great Lakes Bay with Dr. Coughlin with the Federally Qualified Health Center, mental health, and also the VA represented on this group. So we wanted to provide overall direction of the medical response to COVID-19. So one of our main goals was to communicate to local physicians on best practices and CDC updates. We really wanted to help with operations of clinics, for instance, before even the CDC came out with recommendations, we recommended for the people here in Saginaw, for our doctor's offices, to not hold people in waiting rooms and to actually have people drive up, pre-screen them on the phone before their visit, and then screen them again when they got to the clinics to make sure that they had no signs and symptoms of COVID-19. And also, we recommended even drive-up immunizations. We gave recommendations on evaluation and treatment of patients with COVID-19 and help with any updates from the state of Michigan or the CDC when they were released. We developed testing algorithms for our area based on the availability of testing at that time, who should be tested based on exposures and symptoms. And one of the things that I was just so proud of is that we started early adoption of testing sites. We've met weekly with Covenant, St. Mary's, and Great Lakes Bay to make sure that we had testing available for people who needed them. And we helped to identify potential gaps in service. So we reached out to Great Lakes Bay because we were concerned earlier on that people who needed testing but had no insurance or homeless or whatever wouldn't be able to get tested, because earlier on you needed a physician's order or a lab slip in order to be tested. So Great Lakes Bay stepped up and helped with testing for the uninsured people in our community. And also we communicated with the public and physicians on changes in sampling sites. And let me just explain that our sites did the sampling and they sent the samples to a testing center. So our sites were sampling sites. And for instance, Covenant and St. Mary's currently are doing their COVID-19 testing at their labs. And Great Lakes Bay became our only drive-through that you could go there without a physician's order. And it's still like that today. We helped with resources, testing supplies, especially earlier on. There weren't a lot of testing out there. And so we gave testing supplies to the hospital to take to the Bureau of Laboratories. And we gave information out on new laboratories that were provided testing. And for medical professionals, we will start to begin to provide testing at the health department for them for rapid testing. We also developed an algorithm for resource allocations. So who and when do people get, the physicians, medical community gets PPE, masks, gloves, gowns. And then also Garbert gave us a grant for PPE for physician offices. We wanted to make sure that we provided a standard of care for all our clinics and systems. And so we provided guidance to ensure uniform care of residents of Saginaw County, including the PPE and clinic operations, when to do telehealth, when to do in-person care, and gave alternative options for ill patients. So one of the greatest, I think, collaborations that I've seen in Saginaw, working here as a physician for 17 years, was between our healthcare systems. And one of the things I was so proud of was that Covenant and St. Mary's really stepped up and worked together to provide resources for our community. And I'll give an example. St. Mary's opened a respiratory care clinic, and one of our guidance was that if people had symptoms of COVID-19, a lot of our clinics didn't have PPE, so it was hard for us to provide care for people with symptoms. And so St. Mary's opened a respiratory care clinic that would take people with symptoms of COVID-19, respiratory symptoms, and evaluate them, and actually send them back to their prospective hospitals that they're supposed to go to. So if someone had, let's say, ASR insurance, which is the insurance that Covenant provided, they would send patients back to Covenant Hospital to be seen. Or if a patient said they wanted to go to Covenant Hospital, they would do that. And then on the other hand, Covenant Hospital, a part of their hotline, had a part of their protocol to send people to St. Mary's Respiratory Care Clinic. So that was the great collaborations between our healthcare systems, which is something that I personally have never seen before. And I was so excited to see, because the most important thing was for us to provide great care to the people of our county. It wasn't, this is my hospital, this is my hospital. Together, we worked well to provide testing and also just care for the people with COVID-19. And we provided strategies for preparing for resurgence, which we hope doesn't happen, but just to allow people to think about what they may need during this fall season when flu season starts. So I asked Dr. Headrick and Dr. Shanker to come today to tell us about, talk about their experiences being on the medical command and control and the experience with the collaborative effort. So Dr. Headrick, why don't you go first?
Yeah, listen, everybody, thank you. One of the things that I kept thinking about here is that who is public health? We all are. And as a community, this is probably one of the best public health integrations I've seen. I've said that for a few years. In addition, Dr. Pruitt, I want to shout out a couple of people. One is Great Lakes Bay. I saw that note came up. They were integral in this process as well. And the other one is our medical training programs through CMU. I know within our facility, I counted on them. Those were the people, those were the physicians that were taking care of the sickest of the sick with COVID in the intensive care units. They were sitting down and reading books and listening to all the data to help me get things together. So when we went to meetings, I would have knowledge for that. So that support that we give, that's given to us through having a medical school here and having residency training programs at all our sites has really been huge. The other thing, I know that there's a lot of community support, businesses that we'll never even know all these names. We can't possibly mention them all, that would help either well-resourced businesses that are supporting other businesses that are not, so that they can make it through this time. I'm a pulmonary critical care doc. I grew up during AIDS. That was a certainly cultural shift to what Dan was talking about earlier, that culture each strategy for lunch. Thankfully, the culture of this community was designed towards achieving our strategic goals. And I know that time is short. I have tons more that I could say, but I'm going to pause because Dr. Shanker it was also just very engaged, very forthcoming, such a huge help in on how to work this in an ambulatory world. And really through all this, we have a lot of brand new cultures. We have telehealth here. We have people walk around with masks on. We actually have consistent and reliable hand washing. But anyway, Chris and Dr. Pruitt, I just want to specifically thank you two and the county department for being that conduit for us all to get together. And through this double-decker crisis that we went through between COVID on one side, oh wait, a flood, and a dam break on the other side, is that we not only came through it, we excelled. And
hello,
Dr. Shanker.
Thanks for your words, and hello to everyone, and thanks for inviting me here. Unfortunately, my video mode is not cooperating today, so I am only on audio mode. I, as a practicing physician, would like to share a different kind of experience. Dr. Pruitt, Dr. Headricks, and Christina have done a great job in explaining to you what the purpose of this group was and what were the things we covered. I'm going to take a different approach and tell you how it affected me on the ground level in my practice and what was the kind of support I got from this. I have been in practice for 21 years as a pediatrician. I am in a mature, well-established practice. So we usually have a steady day. We kind of have protocols in place. Things happen, our excitement is, or I guess the ups and downs are when we have very sick kids, but typically we have good protocols in place. And then came COVID, and our world went topsy-turvy. So everything we knew how to do had to be thought of in a very different way. And we had about a weekend to make sure we gave good care to patients and also made it really safe for our own staff. So as these ground realities were shifting rapidly on the progression of the epidemic, and the science was still evolving, This command and control center was a true collaboration of the physician community to work on a common goal and vision, irrespective of our affiliation with different organizations. We were able to share and develop the best practices based on CDC guidelines and our own experiences in the office. There was a wealth of information based on everyone's experiences. So we had specialists like Dr. Headricks, we had family practice doctors, we had OBGYN. Everyone was able to give us best practices so we could share some guidelines and then leave it to communicate this with the different community physicians who could then adapt it in their own practices. So as an example, we did very limited telemedicine. We had some experience with telemedicine, but more on collaborating with the specialists at U of M for our patients. Well, now all of a sudden we had to decide who's going to be the candidate for telemedicine, who is appropriate. So we were able to get together and say, hey, listen, our young infants need to come into the offices. They need their vaccinations. We're going to have another epidemic in hand if we don't treat them. This is good guidance. Please bring your young children in. But there are other cases that would be appropriate for telemedicine, follow-ups on rashes, hypertension, making sure people are, managing their diabetes. So this was a very strong thing that was developed and helped people think of how they can adapt this with their own office. We in our office were able to actually split our staff based on this into two groups, one that came into the office and the others that did telemedicine from their homes. So now we were able to also distance our staff in the office, have less people in contact with each other, make it much safer for people to come in. So it was a trickle-down effect. You started at one place, but you actually were able to do many more safety precautions in your office. We were able to put our heads together and say, yes, we can't keep them in waiting rooms. So let's move them to rooms, expand our time on each visit, or have them wait in their cars while we communicated with them and triage them. These were all very, very helpful because alone we could not have come up with the protocol. But when there were several people who could tell what they were doing, we could figure out what worked best for us. It was immensely helpful to have the COVID hotline. I can't tell you what a blessing it was. And then having the respiratory clinics, because it was a really a safe thing for our patients to be able to get in case they needed a nebulized solution or treatment that was very high risk to do in our own offices with no negative pressure rooms. So this kind of collaboration, like Dr. Pruitt said, was extremely unique. We were only thinking about what was good for our patients. And frankly, without the support of the PPE that we got from the Emergency Coalition, we would not have been able to keep our office open. So a shout out to that, because I think many physician offices were able to stay open precisely for getting that kind of support, which we could not even buy on the market. I mean, I could not buy it anywhere. I could not find those supplies. So this definitely kept the offices open. Testing sites. This was also really important for us, knowing where all the resources, where we could send people, where we could get timely results. And in our own office, I will give you an example. There was one day that 3 people said, I have a sore throat, I have a temperature of 100.2, I have a snotty nose. So all very minor symptoms, but as an office which sees high-risk patients, we could not risk those employees exposing other people. We were able to send them to the health department. We got results within 48 hours. They were back to work. Otherwise, they would be out for 2 weeks. This was really, really helpful. It continues to be a really helpful resource as schools are opening and we know we're going to see more sick staff. We're going to be able to get them back to work. So this is a very unique effort. I have never seen such an effort of different organizations coming together, independent of their affiliations, with just a shared vision in fighting the pandemic, helping people, being honest arbitrators of the current science and truth to our patients. So thank you, Dr. Pruitt, Christina, for putting this together, helping us share in this effort, and then further expanding this to our own community providers and who we have contact with. So thank you, and thanks for inviting me.
Thank you so much, Christina Harrington, Dr. Delicia Pruitt, Dr. Clark Headrick, and Dr. Gayatri Shanker for joining us today. The information that you have collectively shared with us is vitally important to our understanding of the health and well-being of our community in this fight against the COVID-19 pandemic. So thank you so much. Just a reminder, we will be offering the virtual business card exchange at the end of our program today. We hope you'll all be able to stay on and join us for this networking opportunity. At this time, I would like to thank our 2020 Premier Perc sponsors, the organizations that make the Percolator Breakfast possible by underwriting all 10 of our events during the year. All of our 2020 Premier Perc sponsors are included on your screen and in your Perc brochure. We encourage you to thank them for sponsoring the Percolator Breakfast and support them with your business whenever possible. And now I'd like to tell you about a few of them. First up, welcome Andrews Hooper Pavlik PLC. Andrews Hooper Pavlik PLC, or AHP, that's much easier for me obviously, is a certified public accounting and consulting firm with 8 offices throughout Michigan. They provide accounting, audit, tax, employee benefit plan administration, retirement planning, and business and IT consulting for individual and business clients. AHP offers the expertise and resources of a large CPA firm while focusing on excellence and providing outstanding value to clients at the local level. Thank you, Andrews Hooper Pavlik. Next up is Blue Cross Blue Shield of Michigan and Blue Care Network. Blue Cross Blue Shield of Michigan is a nonprofit mutual insurance company that has been serving the health needs of Michigan residents since 1939. It's the largest health insurer in Michigan, serving 5 million people here and 1.8 million in other states. Blue Cross has the largest network of hospitals and doctors in Michigan. Nearly 35,500 doctors and 152 hospitals work with Blue Cross and Blue Care Network, its HMO subsidiary. Blue Cross and Blue Care Network are committed to being their members' trust partner by providing affordable, innovative products that improve their care and health, helping everyone make the right healthcare choices, offering valuable coverage, and helping people get quality health care, and increasing access to affordable health care, enhancing the quality of care patients receive, and improving the health of all of Michigan's citizens and communities. Blue Cross Blue Shield of Michigan and Blue Care Network are independent licensees of the Blue Cross and Blue Shield Association. Thank you, Blue Cross Blue Shield of Michigan. And now, with a description of Covenant Healthcare, please welcome Beth Charlton, Executive Vice President and Chief Nursing Officer. Beth?
Thanks, Heather, and good morning to everybody. As a regional leader in medical services, Covenant Healthcare has been fulfilling its mission to provide extraordinary care for every generation through services like cancer care, orthopedics, cardiovascular services, stroke care, robotic care, and our very own birth center with over 3,000 births annually. Also, COVID-19 care, as you've heard about. Unfortunately, that was present, but definitely rose to the occasion related to that. Our award-winning Covenant Emergency Care Center, which is referenced in your materials that were sent out today, is the only emergency room in the region verified to provide both level 2 trauma services to both adult and children patient populations. With many exciting projects on the horizon, Covenant is proud, very proud to call Saginaw home. Over the past 6 months, you heard about the collaboration, and we want you to know that the community stood with our healthcare heroes, and we are so very honored to serve and continue to serve and stay committed to serving this community. Thank you all for being extraordinary. Thanks, Heather.
Thank you, Beth, and thank you, Covenant Healthcare. Next, we welcome Frankenmuth Credit Union CEO Vicki Schmitzer to give us their organization description live and in person. Here's Vicki.
Thank you, Heather, and good morning, all. Franklin Credit Union is proud to serve over 53,000 of your friends and neighbors with their financial, insurance, and trust service needs. Franklin Credit Union was recently surprised, humbled, and appreciative to receive a call from Forbes letting us know that we were voted Michigan's best credit union in member service. Franklin Credit Union thanks you for letting us serve you and our communities. We are better together. Thank you.
Thanks, Vicki. And thank you, Frankenmuth Credit Union. Next, we welcome the State Bank. At the State Bank, their business is to grow and protect your money, but their passion is something much deeper. It is to help you reach your better state. Let the State Bank help you see things differently. The State Bank proudly serves Saginaw and its surrounding communities, with a new office coming soon right in downtown Saginaw. Thank you, the State Bank. And our final premier Perc sponsor this morning is William A. Kibbe and Associates, Inc. William A. Kibbe and Associates is an engineering and architectural firm that provides structural, mechanical, electrical, and civil engineering design services, as well as architectural and surveying services. Kibbe's clients are located throughout the U.S. and come from the industrial, commercial, educational, governmental, and healthcare markets. Kibbe has proudly served the Great Lakes Bay region for 39 years, with headquarters in Saginaw and branch offices in Lansing, Grand Rapids, and Traverse City. The company is uniquely 100% employee-owned by a team committed to nurturing positive long-term relationships built on trust, respect, and collaboration. William A. Kibbe and Associates, your vision is their mission. Thank you, Kibbe and Associates. And now it's time for today's community update with your chamber president and mine, Veronica Horn. Veronica, it's all yours.
Thanks, Heather. Thanks to our speakers today. They're just a wealth of information. We couldn't include the hospitals that are serving our area also in COVID, everything that Ascension St. Mary's, Covenant, the VA Medical Center, Health Source Saginaw. I mean, you see what the Saginaw County Department of Public Health is doing. They couldn't have done all of this without the partners, CMU Health and Great Lakes Health Centers. I mean, everybody was in this. We have a magnificent, robust health community to serve you. Thank you to our premier Perc sponsors. We can't have done this. You see how just awesome they all are. So thank you. The community update is going to be very brief because we still have lots of things to get to. So basically next Friday, September 11th, the Chamber, we're inviting you to join us for our final legislative event of the year, Out of the Frying Pan and Into Manufacturing. The event will feature John Walsh, former state representative, former senior policy advisor to Governor Snyder, and now the president and CEO of the Michigan Manufacturers Association. He's going to discuss the state of manufacturing in Michigan right now and the future in the Great Lakes Bay region, in Michigan, and specifically Saginaw County. So register online for this webinar. It's going to be very, very good, and we hope to see you there and examine the possibilities for growth in Michigan, and the innovation coming to Michigan is phenomenal. So this will be a great series for you to attend. And just a reminder that the Chamber, we're going to hold a real live in-person golf classic on Tuesday, September 22nd at Swan Valley Golf Club. We hope you can join us. We've named it Golf Wars. May the course be with you. And we'll have our usual mix of golfing fun and sponsors, networking, complete with breakfast, lunch, and dinner, and prizes. And for that, you can register on the Chamber's website. And if you're interested in a sponsorship, we'd love to have you. We'll have you contact Susan Moody very quickly because the sponsorships are almost gone. Speaking of our own Susan Moody, nationally acclaimed leader in her field of chambers of commerce, I'd like to invite her, not introduce her, just bring her to you and have her take over the virtual podium for some important volunteer acknowledgements. Susan?
Good morning. Normally in April, we hold the Chamber's annual meeting where we acknowledge the accomplishments of some of our hardworking volunteers. We're all aware that this year has been anything but normal, but we want to recognize these very important people. So we're happy to highlight them here this morning. First up, we'd like to recognize our Ambassador of the Year. Ambassadors follow a process that includes a point system for meeting set goals, and they are required to accumulate a minimum of 300 points to maintain their eligibility on the team. The 2019 Ambassador of the Year has exceeded all expectations in her ambassador role, not only once, but twice during her 6 years of service. She continually goes above and beyond, recruiting new members to the Chamber and actively engaging members at events and programs. Her leadership is an inspiration to the team and has had a significant impact on Chamber membership, growth, and retention. The Saginaw County Chamber of Commerce and its Board of Directors are proud to present the 2019 Ed Dorncipher Ambassador of the Year Award to Dawn Bauscher from the Manor Group. Congratulations, Dawn. Our Diplomat of the Year. The Diplomat of the Year Award goes to the top selling individual from the most recent resource campaign. This recipient has been a member of the Diplomat team since 2016. She's a polished sales professional and passionate advocate for the Chamber. In fact, this is her third time receiving this recognition. It is with heartfelt appreciation that the Saginaw County Chamber of Commerce and the Board of Directors present the Diplomat of the Year Award to Jill Nepperud with Century 21. Congratulations, Jill. And the Chairman's Award. Diplomat campaign teams range in size from 1 to 4 diplomats each. The Chairman's Award is presented to the team with the highest average sales per team member. The 2019 Chairman Award goes to an impressive one-woman team. Congratulations and thanks on behalf of the Chamber Board of Directors. This goes to a real Wonder Woman. Congratulations, Wendy Grohl with Dale Carnegie Training. And the Chamber Challenge Award. Our final award presentation is for the Chamber Challenge Award. This award is presented to the top selling diplomat team of the year, continuing a tradition of excellence, dedication to teamwork, and support for the resource campaign that spans 19 years. We want to thank and recognize Covenant Healthcare, this year's top selling team and recipient of the 2020 Chamber Challenge Award. This energetic team includes Dennis Osler, Leslie Bilodeau, Ryan Ratinsky, and John Holman. Together, they achieved sponsorship and advertising sales over $78,000 and over $1.6 million in over 19 years. That is so impressive. On behalf of the Chamber of Commerce Board of Directors, thank you, Covenant Healthcare, for your unwavering commitment and support for the members of the Saginaw County Chamber of Commerce. The Chamber would also like to recognize standout achievements and efforts of some individual diplomats. These totals are for cumulative totals for their years of service as a diplomat. The Silver Award for over $25,000 in sales goes to Melissa Spranger. The Gold Award for over $50,000 in sales goes to Wendy Grohl. The Platinum Award for over $75,000 in sales goes to Kevin Newmeyer. A Diamond Award for over $100,000 in career sales goes to Jill Nepperud, Kevin Skorson, and Keith Wenzel. The $250,000 award for over $250,000 in sales goes to Leslie Bilodeau, and the Spirit Award to Kevin Newmeyer for supporting a fellow diplomat help make their goal. Congratulations and sincere appreciation for all of your volunteer time and efforts, which allows the Chamber to continue to provide quality events and programming for our members. It is now my pleasure to introduce the new program director for the Saginaw Chamber Young Professionals Network with a YPN update. Turn up your volume. Please welcome Steve Hensley.
Okay, thank you. Thanks for the warm welcome, Susan, and I'm happy to be here this morning. Well, like Veronica, I will keep this brief, but I want to provide an update. So for the YPN, just like the rest of the chamber, we're working through certainly some unprecedented times that, like has been echoed this morning. We are still trying to do what we can in planning events, and so with that said, I want to give an update for a few that are in the pipeline, and then we'll round out with a video I'd like to share. But first and foremost, unfortunately, we had to cancel our golf outing this past Friday due to rain and inclement weather, which was a very big disappointment. But with that said, we're looking forward to 2021 and making it bigger and better, which I think a lot of things will be next year. So, however, later this month, September 17th, we are holding our virtual CEO mixer. It's the first time it's been virtual ever, but we believe it's still going to be a dynamic event. And in the past, what we've had is a panel of CEOs from around the region. We're going to have our Conscious Capitalism Board, and they're going to present how they, as senior leaders, experienced leaders in our community, have handled crises like COVID and other ones as well, and provide some mentorship to our YPs. And then there will be an opportunity where we'll do on the Zoom call a breakout session for our YPs to network and move rooms with different CEOs. So essentially, it'll be a lot like being in person, where we have our network period following the panel. It'll be an opportunity for YPs to connect, collaborate, and speak with those CEOs. So we hope YPs will join us. If you're out there listening, the event is live on our website. You can sign up now, and then there's going to be some other things popping out in emails and Facebook and social media. So look for that. And then finally, in October, we have, it's a little ways down the road, but look for some information in the coming weeks, because the housing market is strong, considering all things. We are going to do a home buyers webinar. So for any YPs who may be looking to be first-time home buyers or in the near future, or looking to move up and moving into a different home, this is a webinar for you. We're going to have some experts from the local real estate industry be able to provide some good information and insight on what that looks like, how to prepare. Questions that hopefully you may have will be answered. And so that'll be a good event that we're looking forward to for the fall season. And so that's what we have in the pipeline. Of course, just like everyone else, we're working with what we have. And so we're looking forward to those events, and we'll continue to work and plan as we can as things allow. So keep an eye out. But with that said, I want to round out my segment this morning by speaking to a video that we've had prepared here for probably a few months, but we've been waiting to release as we navigated these times. So this video speaks for itself truly. But with that said, any YPs out there listening this morning who are not part of the YPN, we hope that this inspires you, provides more information and clarity to what the mission and vision of the YPN is. And for those other folks out there that are chamber members or businesses, if you have any YPs that are part of your organization who may not see this morning, this will be going live on our social media platforms later after the Perc. So feel free to have them search that out and take a look. We're pretty excited. It was very nicely done, and we look forward to what's to come. So without further ado, I'll let Nancy play the video from here.
Well, why did I join the YPN? Let's see. I had just moved to Saginaw, I wanted a way to become more involved in the community.
My boss at the time was a YPN steering committee member.
It was my first day at TriStar, and a coworker of mine stopped by to say hi and welcome me aboard, and he said, okay, first order of business is we gotta get you signed up for the YPN.
She just raved about how much it helped her grow both personally and professionally, and thought it would be a great experience for me as well.
The rest kind of turned into history. I was completely hooked.
The Saginaw County Young Professionals Network is a program of the Saginaw County Chamber of Commerce, whose mission is to attract and retain young talent in our region, focusing on our 3 pillars of engagement, which are networking, professional development, and service.
Essentially, I would like to say is like-minded individuals who are interested in honing their professional skills, networking, and volunteering and giving back to their community.
There's definitely something a little bit for everybody, whether you want to network, you want to work on service. It's just a good way to get out and meet people and get involved and just see what Saginaw and the Great Lakes Bay region has to offer.
The whole goal is just to make our community so appealing that no one wants to leave.
So the YPN hosts a variety of events throughout the year, and I always say there's something for everyone.
We have our networking events, which are informal after fives that we host to just area establishments once a month.
If you're looking at coming on out, having a drink after 5, networking in a casual setting and getting to know other people in their community, can't beat a YPN after 5.
Luncheons with usually a guest speaker on some kind of topic people can draw information out of.
Every time I've attended those luncheons, I've left with being inspired or some nugget of wisdom that I can take back with me to my organization.
The CEO Mixer is an event where there are usually 10 to 15 CEOs from major organizations throughout the Great Lakes Bay, and it allows young professionals to come together in a casual setting and get to know them.
It's insider knowledge that the majority doesn't have access to.
We host a nonprofit expo, so for young professionals who are interested in volunteering with a nonprofit agency, maybe volunteering on a board, that event's for them.
It's allowed opportunities to not only serve as a board member for a variety of local nonprofits, but it also allowed me to get out and really get my hands dirty in the community to volunteer for a variety of different organizations over the years.
This year we've done drives for Hidden Harvest, and we will be doing a drive for Shoebox Saginaw where we collect personal needs items. We created a beautiful mural in downtown Saginaw this year, which was really exciting.
We've done everything from Habitat to Humanity to City Rescue Mission to landscaping projects. It truly is an extraordinary way to give back.
You're actually physically seeing an impact that you get to be a part of.
Being part of the YPN has made a huge impact on me. Sitting on boards or leading a team, event planning, or even just basic networking, that was all new to me, and it was very intimidating. So the biggest impact that I had was just seeing myself grow professionally and personally, gaining confidence and earning some skills that I've actually added to my resume that I would not have had if it hadn't been for YPN.
Not only can you build friendships, but you'll build connections throughout the community, and it's a great way for someone that's just moved into the community to quickly be adapted and surround yourself by great people.
You're not gaining a network, you're gaining a family. It's the ability to be comfortable wherever you're at. And as we all get older and move into more leadership roles, we're all already comfortable with each other. So I think it just strengthens it for our community.
We are seeing a time where young professionals are choosing Saginaw and the Great Lakes Bay region. They're choosing to live here, work here, play here, and to have an organization like the Saginaw YPN is huge to act as a nucleus for driving young professionals to have a satisfying place to call home.
I recommend it to people who are new to the community because it gets you in touch with a lot of people and you go a lot of different places. And I recommend it to people who, like me, were from Saginaw and lived here my whole life, but just really wanted to step out and experience it in a different way and get more involved.
I mean, there's not one thing I've done with YPN where I'm like, it could have been better. No, I love this. Everything we do.
Without the Young Professionals Network, I don't know if I would have necessarily called Saginaw home for the long term, and it's blessed me with opportunity beyond belief, and this is home to me. This is where I've planted my roots.
We're ambitious, we're passionate, we're motivated by cultivating change. And if that sounds like you, and you're interested in being the change that you hope to see in the community and better your organization and your personal self, then the Saginaw Valley YPN is for you.
Thank you, everyone. And what an outstanding group of young leaders we have. I'd encourage you or your people in your businesses to get involved in the Young Professionals Network. You won't be sorry. They really help deliver and develop the next leaders for our community. So now we're going to wrap things up. I want to take just a minute to thank our wonderful chamber volunteers, our ambassadors who help us stay connected with our members and staff at our events, and our diplomats. Thank you all so much. You help us fund the exceptional programs and events for our members and what we expect. I also want to thank our Chamber Board Chairwoman, Heather Gallegos, for helping me MC today's program and for providing leadership on another one of our Chamber volunteer groups, the Chamber Board of Directors. Today, we want to thank our sponsors as well. We appreciate their support and participation. And again, without sponsors, we couldn't provide the services and events that bring us together to communicate, connect, and influence our way to a thriving business community. Before we wrap up, I'll tell you, as soon as I finish my comments, we will put you into the breakout rooms. I hope you can stay with us and chat with others in the community on the state of your business and what's going on in your business. Our next virtual Perc is on October 1st. And it will feature Michigan Chamber of Commerce President and CEO Rich Studley to take a look at what to expect at the polls in November. Ought to be interesting. Thank you all for joining us this morning. I hope you enjoy the rest of the day. Have a safe Labor Day weekend, and we will see you all soon. We are adjourned.